Hey everybody, I'm here with Mr. Zachary Lott at Nexus Healthspan. You can find them at nexushealthspan.com. So we're here to talk about ED and some of the treatments they have there at their practice and the success they're having with the patients there. So Zachary, thanks so much for joining us today. I really appreciate it.
Yeah, it's a pleasure. I'm happy to be here.
Yeah, and I wanted to start off just by asking how long you've been working in the men's health space.
Yeah, so I spent about the last 5 years working in men's health. I used to work for a practice that specialized in hormone replacement therapy,
Mhm.
and then we introduced a men's health program specifically there for ED. And something that's closely related to that I have a passion for is cardiovascular disease. And
Mhm.
so my current practice, I tie all those things together, really focusing on quality of life and health span.
Yeah, that's great to hear. And so you just saw the real need for, a clinic specifically for that, and you decided to get into it for those reasons?
Yeah, absolutely. Because a big focus of what I do taking care of people is, modern medicine can keep people alive for a very long time, but
Mhm.
I'm more interested in keeping people healthy for a long time and quality of life. And when we talk about men's health and sexual health in particular,
Mhm.
sex is a real important thing to most men. Some
Mhm.
men's goal is to have sex until the day they die, and so that's
Mhm.
one of the reasons why men's health can be such a rewarding thing. Because if you can give that back to someone, their quality of life improves significantly.
Definitely. I think that's a great point, not just the length of life, but the quality of life as well. It's a great
Yeah.
point. Mhm. And so, what do you feel like it is that, most men feel like, they can't discuss that and talk to, their primary care about that? And do you feel like, just getting the education out there can help that?
Yeah, that's real big, and it's first of all, it's really common,
Mhm.
but I think a big reason why it doesn't get discussed with primary care providers is there's not always enough time,
Mhm.
and most guys are frankly a little bit embarrassed to say, "Hey, I need an appointment with my primary care doctor to talk about why things don't work like they used to."
Right.
And so more often than not, it ends up being that door handle question when someone's about to leave. Hey doc, can I get some of the blue pills too? And then
Mhm.
it's a quick script and a brief assessment, and maybe that's all that's thought about it.
Mhm.
I have really have a good opportunity to spend a fair amount of time with the patients that I take care of, and so we're able to talk about all those things that may not get addressed in a short appointment with a primary care provider, but
Mhm.
we're able to not only address erectile dysfunction, but address the underlying root cause of why there may be any change in erectile quality
Right.
or erection quality in general.
Mhm. Yeah, it definitely makes sense. And so what are some of the common causes of ED that you guys see there at your practice?
So, by far, the most common cause of ED that I see and treat in my practice is called vasculogenic ED, or
Mhm.
vasculogenic erectile dysfunction. And it has to do with a problem with the blood vessels.
Mhm.
And so there's some good research that shows if someone presents with cardiovascular disease,
Mhm.
their 4 year risk for excuse me, if someone presents with erectile dysfunction, their
Mhm.
4 year risk for an adverse cardiovascular event increases pretty substantially.
Mhm.
Because if you think about, well, why wouldn't it work like it usually does? Well, maybe
Mhm.
it's a blood flow problem. There's not enough blood flow to the genitals. Well,
Mhm.
why isn't there enough blood flow? And you got to think about atherosclerosis and plaque in the arteries.
Mhm.
And so one of the things that I do in my clinic is when a gentleman comes in and he's had a change in his erectile quality, one of the first things that I do is
Mhm.
an ultrasound, and I put an ultrasound on the carotid arteries, which are the large arteries in the neck.
Mhm.
They're close to the surface. They're easy to image. And ultrasound technology is quick. There's no radiation, and I can see within seconds if there's a problem in the wall of the arteries or not, and can show someone, hey, this is why things aren't working like they used to.
Right.
If that's the case, that patient may be a candidate for oral medication, shockwave therapy, and other different types of procedures that we can do in the office.
Mhm.
Other causes of erectile dysfunction that are common, I'd say that the next most common one that I at least see in my office would be something to do that's psychological,
Mhm.
whether that be someone isn't performing the way that they're used to performing,
Sure.
and it's like this negative loop that gets created in their brain of
Mhm.
it's not going to work, and then there's a little bit of doubt that causes a little bit of stress. And
Mhm.
when we get that kind of, we call it a sympathetic tone
Mhm.
increase, kind of a rise in the stimulation of your fight or flight response,
Right.
erection goes goodbye. And
Mhm.
so stress, and that could be depression, any kind of down or stressful emotional state will interfere with it. There's also injury. So say someone has had a radical prostatectomy, where the nerves may have been damaged from surgery. That can cause erectile dysfunction. Drugs can certainly cause erectile dysfunction. So certain blood pressure medications are known to have some sexual side effects.
Okay, so it really does depend, what is causing that issue that determines what you guys are going to do as far as treatment wise. It's not just like a one size fits all.
Oh yeah, it has to be a custom tailored approach. And another thing that I've done a lot of work with over just the last probably 3 or 4 months is men with Peyronies disease. And that's where an induration or a plaque develops inside something called the cavern of the penis that carries blood. And it can cause curvature of the penis. It can cause a painful erection and uncomfortable intercourse. And there's treatments that can be helpful for that as well.
Okay. And which of the treatments in your practice do you typically recommend for that?
So I've had good success in that with focused shockwave therapy. I have, I'll give you an example of one patient I have. He suffered a pretty severe injury to his genitals about 4 or 5 years ago. And after treating him for about a month, he came into my office on a Monday morning and he told me that he was able to have penetrative sex for the first time in 4 years.
No kidding.
Which is incredible.
Yeah, absolutely. And, for the viewers that might not, know what shockwave therapy is, can you explain a little bit more about how that works?
Yeah, absolutely. And I think, so there's a couple different types of shockwave therapy on the market. And I think it's really important for healthcare consumers to know the difference between the two. So shockwaves in general, a shockwave is probably best described as an acoustic disturbance. Think of a sound wave of any sort. And it does two things. It carries energy and it travels through a medium, or like the tissue, for example. And when we look at the different types of shockwave therapy that are on the market, in particular for erectile dysfunction, the most common form of shockwave therapy is called radial acoustic wave therapy. The other one is focused shockwave therapy, and that's what we have in our office is focused shockwave therapy. And the two things that they have in common is they both do something called they increase cell wall permeability. So it allows things to get in and out of the cell more easily. They stimulate microcirculation. So you can see an improvement in blood flow almost immediately during a treatment because of the improvement in microcirculation and vasodilation, or dilation of the blood vessels, that occurs. Now, the biggest differences between radial acoustic wave therapy and focused shockwave therapy is how the devices are classified. So radial shockwave therapy is a class 1 FDA device, meaning it carries the low risk for potential harm. Think of an electric toothbrush. I believe an electric toothbrush is a class 1 device. Where we compare to a focused shockwave device, it's a class 3 medical device. So it has the potential to cause harm. So someone has to be licensed and skilled in operating it.
Sure.
The radial device is most widely used, in part because more people, unlicensed personnel, can be trained as a technician to use it, and they're less expensive. So that the focused shockwave machine is obviously a more expensive piece of equipment, but the focused shockwave machine is the one that was used in all the seminal research studies that shows that shockwave therapy is effective for erectile dysfunction. And I haven't seen a single study to date that shows any research that's been done for erectile dysfunction or Peyronies disease using radial acoustic wave therapy. And I think that's really where I draw the line in. Well, what's the best equipment to get this job done that's effective and safe and evidence-based? And that would be the focused shockwave therapy.
Okay.
Now, the other big difference between the two as it pertains to the consumer is the radial acoustic wave therapy is painful. People are required to put on a numbing cream, and even still then, it's not tolerable for some people. Whereas the focused shockwave treatment, it's painless and it's quiet. When it operates, it sounds kind of like a barbecue lighter or the lighter on a stove, just tick, tick, tick. And it's painless. Sometimes if a shockwave were to be directed towards like the pubic bone or something, you may feel a little bit of discomfort, but in the soft tissue, it's painless. So I think those are the biggest differences between the two different types of shockwave therapy.
Mm-hmm.
And in summary, really, focused shockwave therapy is the one that's most evidence-based. It's been used in all the research to show that this is effective for erectile dysfunction and Peyronies disease.
Okay. Yeah, definitely makes sense. And so what kind of results have you guys seen at your practice with that specifically?
So the way we measure results is we use this form. It's called the IIEF, and it's an inventory that allows us to objectively assess the quality of someone's erection. And so we see a pretty significant improvement in IIEF scores. So we're able to see an objective increase or improvement in someone's reported erection quality. So scores are improving, meaning erections are getting better. I always I routinely see the men who I treat in my practice, and so it's kind of it's a fun part of the job, hearing their stories and hearing the changes and the updates throughout the treatment process. Even if it's small stuff, it's a marked change, and it's nice to hear those things. Like, for example, I woke up in the middle of the night and I had an erection which hasn't happened in years, or it just seems like it's bigger during the day and haven't done anything else. So those are all good signs of an improvement in blood flow.
Definitely.
Other things that I've noticed is the patients with Peyronies disease. They have a slight decrease in the curvature of the penis, but their erection quality is better, and there's less pain with an erection and during intercourse. So quality of sex is better. Other things that don't often get talked about that I see with this therapy is, aside from an improvement in erections, some men report an improvement in the quality of orgasm.
Okay, yeah, that's great to hear. And so is it really anybody that has that plaque buildup or the Peyronies disease that would be a good fit for that?
Well, I think anyone with vasculogenic erectile dysfunction or with Peyronies disease, or a combination of the both, would probably be the best candidate. What the research shows is that this stimulates the body to release certain growth factors, and some of those growth factors, what they do is they stimulate blood vessels to grow. So there's one called vascular endothelial growth factor, and it stimulates something. It stimulates the tissue essentially to build new blood vessels to improve blood flow. And so when we're working with a blood flow issue with the vasculogenic erectile dysfunction, it's in my opinion one of the best tools that we have for improving it. And it's a good adjunct to either someone who's on oral medication already or someone who's just starting to have a change in their erection quality. It's a great adjunct to treatment, and for some men it gets them off of an oral medication. I've had some patients who've been on injectable ED medications, for example, like Trimix, and I've seen them cut their dose of Trimix in half. I have one gentleman who's completely off Trimix now and is back on oral medications, and I've had multiple men who are on middle-of-the-road doses of oral medications like Viagra and Cialis who no longer require them to have intercourse.
Yeah, it's great to hear. And so it really does improve, the efficacy of those medications as well.
Yeah, so it allows their body to better respond by, I think, just improving the blood flow. You get more blood flow, new blood vessels, and then you get a better response to the medication. If you've got more blood vessels to work with, really, you'll get a better response.
Yeah, that makes sense. And so on average, how many sessions are you seeing that patients typically need with that?
That's a really good question, and it's very, very variable. The standard would be roughly six treatments, which I think is not enough for most people. I have patients who've done over 18 treatments. I've got one patient who's done 24 treatments. And I have some patients who've had success with 6 treatments. So really, it depends on a couple different factors. It depends on, one, how bad is it to begin with? 2, what's your health history like? If someone's a diabetic smoker with high blood pressure, probably not going to get results. And if we do get results, they're probably not going to stay for very long. Now, there's some research done on the topic that showed that those men who got a benefit from focused shockwave therapy, after the 2-year mark, 78% of them still had that benefit. And I think the rest of the people who didn't sustain that benefit, I think that's more based on their underlying health conditions and those not being addressed. And I think that's one of the biggest value propositions that our clinic has is, yeah, we're good at treating ED, but we're also good at identifying the root cause of erectile dysfunction, and we're well equipped to take care of that as well.
Yeah, it's great to hear. So if they really need to make those lifestyle changes to get the full benefits, and you're going to encourage them and let them know what they can do.
Absolutely. Whether that be lifestyle changes, diet, exercise, nutrition, sleep, that's easy stuff. We also do medical management for cardiovascular disease. Our practice specializes in cardiometabolic disease, so the prevention of heart attacks, strokes, and diabetes. And so we're well equipped to handle all those things.
Yeah, definitely. Because I think that was an interesting point you brought up at the beginning is, if you see somebody has ED because of those reasons, you would imagine that, they're having that plaque and that buildup in other places too. And that can be obviously pretty dangerous.
Oh yeah. And I think that can be some of the greatest disservice to men is if they present with erectile dysfunction, they need a cardiovascular workup. Mm-hmm. There's lots of things that warrant a cardiovascular workup, but certainly erectile dysfunction is a big red flag for it. And those are the guys I want to see in my office.
Yeah, definitely. And so what do you feel like are, really just some ways that patients can know if they should reach out and, get that help and really just kind of stop, treating it as something where they're leaving their primary care and they're just like, hey, it's just kind of a last ditch effort type thing.
Yeah. Anyone who has noticed any change in their own body, whether it be, some of the most common complaints that I see are fatigue. Someone doesn't recover from workouts like they used to. They're tired all the time during the day. They can't keep up with playing with their kids anymore. And it doesn't work like it used to. Right. That's when you need to go seek professional help. Go talk to someone who knows what they're doing in the space of men's health or erectile dysfunction, and really take a deep dive into your own health. And it's not difficult to get a prescription for Viagra if you have erectile dysfunction. But the most important thing is why do you have erectile dysfunction? I think that's a bigger, broader question that should be answered. Right. And I think as a provider, that's I owe that to anyone who I take care of, and it's something that I get real passionate about because we can address a lot of that stuff.
Mm-hmm. Yeah, absolutely. And I think for a lot of guys too, they might be seeing the Viagra as a solution to it. But obviously, that's kind of a BandAid solution. It's not something that's really going to fix that problem.
Yeah, it's like putting a BandAid on an arterial bleed.
Right. Definitely. And what would be the best way for patients to get in contact with you guys there?
So we're really easy to get in touch with on our website. If you go to our website, which you mentioned, nexushealthspan.com, there's a blue button in the top right hand corner. You can click on the button. You can book a complimentary consult. And I like to talk personally with a lot of the patients that I'm going to care for and make sure that I'm the best person to be taking care of them. Mm-hmm. So I book complimentary 15, 20-minute phone conversations with people just to make sure they're a good fit and that we can take care of them. And then we have a lot of information available on our website, both about men's health. We even take care of a lot of women, erectile dysfunction, cardiovascular disease, and a number of useful blogs on the website too. They're mostly from commonly asked questions that I get.
Mm-hmm. Okay, yeah, that's great to hear. And those are the questions that I had for you. Was there any last advice or anything you wanted to leave the patients with if they're just struggling with that and not really sure what to do?
Yeah, certainly. So people are very intuitive, and I've been doing this long enough to realize that when someone notices that something feels off or different in their body, or they think their hormone levels are off, or something isn't working like it used to, it's not in your head. Get it addressed. And if the first person that you go seek for help checks your levels and says everything's in the normal range, that doesn't mean there's still not an issue. Keep looking.
Right. Yeah, I think that's great advice.
Thanks.
All right. Yeah, absolutely. Well, thanks so much for taking the time to talk with us today and share the education. I love the work you guys are doing there.
Yeah, it's my pleasure. I appreciate you having me.
Yeah, definitely. Have a great rest of your day.
You too. Take care.
Thanks.